What's going on, everyone? Dr. Tyler here. I'm a chiropractor in Newport Beach. Today we have a great video. She's a soccer ref. She's a professional soccer ref, and she's going for her like FIFA certification badge, and she has a really big fitness test coming up. She's really stressed. She has a lot of pain throughout her spine, and hopefully I can take some of that out and help her get through her test, maybe a little bit more pain-free or a little bit faster. But before we get into that, I want to take a quick minute to thank today's sponsor, Audible. So I'm all about graduating through life, and right now this is kind of getting in my way. So I've been listening to this book called The Mountain Is You by Brianna Wiest. Using this book, it really inspires me to dive a little bit deeper to find why I'm feeling like that. Audible is a company that allows you to listen to books rather than read them. If you have ADHD like me, it's really hard to sit down and read a book. I have to be listening to it while I'm doing something like going to the gym or I'm driving. Audible is so convenient and I'm such a big fan. It has the widest selection of genres, so there's something for everyone. If you want to check out The Mountain Is You or any other book, new members get to try it for free for 30 days. All you have to do is visit audible.com/Dr. Tyler or text Dr. Tyler to 500-500. 30 days for free. Do it. And just again, I want to thank Audible for sponsoring today's video. Let's get right into it. Like and subscribe. Wow, these actually feel pretty good. What can I help you with?
I thought this was bad.
Not from what I've felt this morning.
Actually, something that's kind of been concerning lately, like when I'm driving or if I'm sitting for a really long time, I get like kind of sharp pains going through here.
Okay, how far does it go?
Probably just mid.
It wraps
It
here?
No, it's more under.
Okay,
Like
under.
from here.
And it goes to your knee,
I know
kinda?
I know it for sure starts like up here.
Yeah. Okay.
And then like it shoots through my hamstring.
Okay, a little sharp.
More sharp than dull.
Any accidents, injuries, surgeries?
Meniscus on the right. But that was
Okay.
like over 10 years ago, I think.
Oh man, you know,
Too
every
far.
time it's like, yeah, I got in a really bad car accident,
But
totaled my car, but that was like 10 years ago. You know, your spine doesn't forget.
I know.
Your knee doesn't forget.
No, it doesn't.
Yeah.
Actually, my right knee's been fine since surgery, but now my left knee is starting to feel how my right started to feel.
This is probably related to the knee surgery.
Okay.
No matter if you get surgery and you have no pain anymore, your brain sees it as it doesn't work.
Oh.
So when you are doing certain things, you really just have to like close your eye, like feel it. You know what I
Okay.
mean? Just
Yeah.
think like, oh wow, when I walk, I can feel my knee.
Yeah.
I can feel it right there, you know? Because a lot of times we, without even thinking, we're kind of avoiding using it. You know what I mean?
Okay.
And it doesn't matter that you went through physical therapy and stuff.
Yeah.
Like, it has to be a constant reminder, like, yeah, it is still there. Wow.
Okay.
Crazy. Okay, so just try to do that as much as you
Okay.
can. So yeah, these feel pretty good, pretty toned. You're in good shape. There are still a couple spots in here.
Yeah.
Right in here.
Yep. Oh, yeah.
It's hard to get it because you're so ripped.
I feel that in my brain.
So if you ever have headaches there, now you know where it's coming from.
Okay. I can't believe how far I felt that in my head.
I know, and you know, a lot of times people with headaches that are right there, they're like, oh man, let me just pop all these pills. All you need to do is kind of loosen up these muscles a little bit. There's a spot in here that's a little pissed off. Nerve that comes right through here is being affected. But there's always other things up the chain. Okay, so we got QL for the students. We're going QL. We're gonna actually adjust this rib cage area here. It's popping out a little bit. So, loosen up, pull this down, get in here. Probably get in here too. Let me know when you can feel like a stretch kind of like right in here, okay?
Oh.
Jesus. That was crazy. Now we get in here a little bit. Who's like your favorite soccer team?
I actually don't have one because I actually don't watch a lot of soccer.
Okay. That's probably good though for your job, right?
I always try to start watching games and like watch my colleagues, and then I get overwhelmed and soccered out. So I'm like, I'm just gonna stick to my work.
Soccered out?
Yeah, there's a lot of soccer.
There is a lot of soccer. I remember I went to England with my soccer team and like those people are crazy, man.
Yeah.
They love their teams.
Yes.
You know what I mean? Beautiful. Okay, students. There's a bone here. It's called your PSIS. You go medial to it. There's a little tiny rubber band in there. Little ligament. Do some cross friction on it. Make it shut up. Yeah, it doesn't feel good either. But eventually, if I do this long enough, it'll just become numb. Okay, a little bit of the erectors right in here. I'm going to loosen those up. And then we have to get into the QL from the side, especially because her erectors are pretty toned. Got to get right in there, okay? And then we can kind of pull this down and bring it up. Good. Just remember, it's for science. We're doing this all for science. Right there. We're right on it. Okay, now just take nice big deep breaths.
Is this gonna make me run faster?
Probably not. It's gonna make you sore tomorrow though. Does it feel good, bad, or nothing when I do this?
It's not bad.
I gave you 3 options. Lift, down, and you went with the 4th. Does that feel good, bad, or nothing, or just weird?
That feels better.
Okay. It feels relieving on your low back?
Yeah.
So sometimes with these things, we can kind of follow it all the way up as well. So these erectors go all the way up. So we're going to be able to find a spot pretty much along the whole thing,
Everywhere. Yeah.
all the way up to her neck. There's usually a really, really tender spot in her neck, usually the upper neck.
Yeah.
Relax right here. Only power lifters or CrossFit people get this. Relax right here. She can't even. This is relaxed her. I can't even get it through it. Okay, right here. Right in the suboccipital triangle. These are really common spots. High stress. You're in a high stress position with your job. You know, everyone's yelling at you.
Okay.
If one side likes you, the other side hates you. You know what I mean?
I don't think that's ever the case, really.
Really?
Everyone just hates me.
Oh, I see. Okay. That's awkward then. I'm going to do a little bit of vibration. I'm going to start down here. Just kind of bringing new blood to the area, okay?
Okay.
It's a brick. It's tight. It needs to be pulled apart rather than pushed down. So I like to open up segments here, get some vibration in them, and just give a little shake. Yeah, it's going to be really tight in here. S2, S3 needs to go this way. So we're going like that. And I think I'm going to pull this down. That needs to go too. That's probably like L5. Is that tight at all? Does it hurt?
I feel, yeah.
Okay. Lay on your back, face up. So right side occiput. It's going to be great. Great. Atlas here, students. All the way, a little rotation. Good.
I've never heard cracking so high up.
Me
in my
neither.
head.
I've never done that before in my life. So we're going pretty low. It's like S2, S3. I know they tell you you can't adjust certain segments in the sacrum, but that's just where I'm going to contact. Right in here. Drop down straight on it. God, it's so good. So PSIS is here. Got to go up a little bit and we feel L5. I'm only going to be able to get in with this. So that's what we're going to use. Beautiful.
I feel like this is going to make me run faster.
Honestly, whatever you think, I will claim responsibility.
Okay.
If you are taller and you run faster, I claim responsibility. But if you're not, then I don't claim responsibility.
Okay. Because I have a fitness test next Friday.
Oh, crap. Yeah, you're probably not going to run faster. But if there's a will, there's a way.
Yeah.
You know, there was the first time I've ever thrown up from running was, and only time actually, was when I did a fitness test for a college soccer team.
Oh.
Yeah, I was puking out Gatorade. Okay, just let this leg fall. Good. I'm gonna do that Y strap thing on you, okay?
Okay.
Have you seen it?
Uh-huh.
Okay. What are your thoughts on it?
It's a little scary, but
What if I told you it made you run faster?
I'll do it.
All right, cool. Like how I said, it's kind of like a brick in your mid back. It needs to open up this way,
Okay.
okay?
Yeah.
And there's a lot of other benefits besides running faster.
Okay. You want to make me taller? I'm trying to hit 5'7".
Bro, I got you. Lift your head up. So I'm just gonna set it up and stretch you out a little bit.
Okay. Do my hands need to be in a certain?
Wherever you want. This is your time to shine. Just don't reach for your back pocket because I know that's where the red card is. Let me know when it starts to feel like a nice stretch in your neck.
Yeah.
Good. And just try to let that stretch go all the way down to your low back. Let me know when you can feel it there.
Holy.
Yep. Down.
Oh my
Damn.
God! I feel it in my lower back.
Me too. Ben. Nice big deep breaths, okay? I want you to take a big breath in and try to breathe all the way down to your tailbone. Does that make sense? Yes.
Oh, I'm definitely 5'7".
Yes. Same. That was good.
Oh my God.
Yeah. Yeah, it's
I
like
still
that.
feel it in like the whole way.
That adjustment, it's kind of like, imagine you've never worked out in your life and you went and you did like a spin class. You know, you're gonna be sore.
Yeah.
Okay? This is kind of similar. If you're sore, it's normal. It always goes away.
Yeah.
Sometimes it lasts a couple days, but please don't hate me. It's for the best, I promise.
Yeah.
After a couple days, that's when I want you to like really think about like, okay, did that help? That's when I want you to think about it. I don't care how you feel today or tomorrow. Once it's done healing, that's when I want you to be like, wow, I did run faster.